Guys, welcome back to Medical Coding with Blue. Today's episode is all about should you pursue a degree in health information technology or health information management, or should you pursue the medical coding certifications? If you are brand new to my channel, welcome. I am Blue, I'm a medical coder. Okay guys, so the answer to this question lies in what is it that you want to do? If you are just wanting to be a medical coder, by all means, pursue the medical coding certifications. All you need is one. There are two major medical coding associations, the American Health Information Management Association and the American Academy of Professional Coders. Now, the American Health Information Management Association has the CCS, which is a Certified Coding Specialist. That is the gold standard of medical coding credentials. There is the CCA, the Certified Coding Associate, and they have the Certified Coding Specialist Physician Base, the CCSP. Now, on the other hand, there's AAPC. They have their flagship credential, the CPC, which is a Certified Professional Coder. Now, any one of these can get you going in medical coding, okay, guys? If that is what you want to do, if that's what you want to pursue, then by all means, go ahead and do that. Pick one of them. And I've done plenty of videos about the differences and which one should you pursue. I actually did that just a few days ago. But if you are thinking about pursuing a degree in health information technology, that is the associate's degree, or health information management, that is the bachelor's degree, there's a few things that you have to consider, okay? First things first, if you want to be a leader, if you want to be an educator, if you want to manage departments, then that's when you should pursue the degree programs. Now, the reason that I say this is because when you look at the syllabus for the health information technician or the health information management degree programs, you will see that the medical coding portion of those degree programs is very small in comparison to everything else that you're going to be learning in those programs. Those programs are really designed to instruct our leaders, right? And get them to be leaders so that we have leadership in the community. But the coding part is very small. And so it's the concentration is not there when it comes to the degrees, when it comes to learning medical coding. And oftentimes when you are out in the workforce, if you are a medical coder and you have like the RHIT, for example, sometimes some employers will ask that person also be medical coding credentialed, either with the CCS or the CPC or something else, you know. So they are really wanting to make sure that you have that knowledge base, even though you have a degree, okay? And the reason that some people will pursue the degree is because like they'll get with a recruiter from a school, and the recruiter will say, oh yes, you can make so much money if you have a degree. I have proven that to be not true, because having the CCA for 13 years, I now have the CCS and the CCSP. But when I did have the CCA, I outran degree holders all the time when it came to money. And when it comes to money, how do you make more money in this industry? You make more money by having knowledge, not by having a bunch of credentials, not even by having a degree. Because a lot of people will work as medical coders even with degrees. And technically you're working under what the person who has a degree should be working as, right? Because again, a person with a degree has the knowledge and the capability to manage people, lead people, to educate, to do all of those things rather than just the medical coding. Because medical coders are the worker bees, okay? That is what we do. We are worker bees, to put it just plainly. Yes, that's what we do. We work. And again, the top level management, you know, being with the degrees, right? They're the ones that are going to be making decisions. They have a very important job about, you know, making sure that everything is secure, everything is managed well, and everything is staying within compliance because that is what they do, and that is their concentration. They can't be trying to code and trying to do all these things at the same time. So that's why we have jobs as medical coders, right? So again, if you are thinking about, well, should I get the degree or should I get the medical coding certification? Ask yourself that question. Do you want to be a medical coder? And if the answer is yes, I just want to be a medical coder, I don't want to lead people, go with the medical coding certifications, okay? Any one of them, any one of the four. All you need is one. You do not need multiple, all right? There's a lot of people who try to sell, they'll try to sell the CPC and the CCS in the same thing. Oh yeah, you can get certified through both. Guys, you're overlapping at that point. And again, why are you doubling up when all of the job listings are just asking you to be certified with one? I have never seen a job listing that says candidate must have multiple credentials to get this job. And even if there was such a listing, I would really question the motive for that particular job, because if you really know what you're talking about, you'll know that the candidate only needs one certification. I'm just saying. And for those that are saying, well, I want to work in a hospital, and my hospital, they only want everybody to be with a degree, like the RHIT or the RHIA. I know that's not true, because I see that a lot in the job listings. They say that candidate must have a RHIA, RHIT, or be credentialed through one of the associations, AHIMA or AAPC, and then they'll list the CCS, CCSP, the CCA, or and so that's what they do, guys. So it's really all about reading the fine detail when you're looking at these job listings. Having a degree will not guarantee you more money. So if that's why you're doing it, then you're doing it for the wrong reason. Not only that, you're making yourself spend more money when you really don't understand what the industry is all about. Now, if you have been a medical coding credential holder for years, and you want to move up, and you decide that you want to take the plunge, and you want to be like, okay, I want to pursue the degrees, then that's fantastic, because you've had time to develop as a medical coder. So that way you've seen everything that's going on, and you understand the process. You know what you can bring to the table as far as, okay, I know how to code. So if there's a dispute between the auditor and the coder, then I can break that tie, right? And so if you have that ability and that capability, which a lot of degree holders don't have that capability, because they get into it and then they get thrown into management because they didn't know, but the company or the hospital knows that that's what they're supposed to do. And so they just kind of get thrown in there and just like, okay, But you knowing medical coding already, and you understanding the whole process and understanding what it means, is going to put you at a different level, and it's going to make you even more capable of doing the work of a leader. So, having that under your belt is a great thing. Continually educating yourself so that you can get to those degree programs is a wonderful thing. There's only one school that I will recommend, and my link for them is in the description box below. You have to look in the description box in order to find that link. But I only recommend this one particular school because it is approved through CAHIM. That is the Commission on Accreditation for Health Informatics and Information Management. And so you have to go, anytime you go through the degree programs, it has to be approved through CAHIM. Now, I will leave the CAHIM link in the description box below, so that way you can see if your college or university is approved on their program list, so that you can be approved to sit for either the RHIT, which is the associate's designation, right? Or the RHIA, the Registered Health Information Administrator, okay? You have to make sure that the program that you're going through is approved through them, because if it is not, then you are not going to be able to be eligible to sit for that designation. The school that I recommend is approved to be able to sit for the RHIA when you complete it. So there's no obligation. If you click on the link, it's just for more information, and that's all. Again, it's just for your information. Again, you don't have to sign up for the school. It's just so that they can tell you about their program and what they offer. But there is, you can apply for scholarships with this school, and you can apply for financial aid as well. So that's something, if it's an option that you are thinking about, then by all means, see about pursuing that. And sometimes with these employers, when you've been on for so many years, that's a tuition reimbursement is a part of the employment package. And a lot of people don't take advantage of that. And they think that they have to pay for it all out of pocket. if your employer is willing to pay for some of your tuition, then by all means, go for it, because we are in a very educated field, and anytime you can take advantage of getting additional education and it's not coming out of your pocket, all you have to do is use your brain power, then you should pursue that, but that's just my advice anyway. But yes, that's what the degree designations are for. They are for our leaders. Now, yes, there's lead medical coders that have RHITs, and they manage the medical coders, and then they report to the department head, right? Usually the RHIA. And sometimes the RHIT will be the department head. It all depends on the facility. Some facilities will require the department head to be an RHIA, right? To have their bachelor's at least in health information management. And some will say that the associates is just as fine, so it really all depends on where you are. But again, pursuing the degrees means that you're going to be learning about the laws of of our industry, and you're going to be learning about ethics and things like that, and managing people. And those you can see in the in the syllabus for any one of those programs, okay? And that way you can look at all the things that they have to offer, and the fact that it's concentrated on compliance and things like that. And again, that's where the programs, the degree programs differ so much from medical coding, because medical coding is literally concentrated on the coding portion. Both of them, though, the RHIT program or RHIA program, they do have a small portion of it as coding, but again, it's not as in-depth as a medical coding program would be. And a medical coding program, a lot of you are experiencing, is very self-paced, and you're learning on your own. There's a lot of places where you're going to be learning on your own. Even with the degree programs, you could be learning on your own as well. So it really all depends, but that's just something that is a part of the industry. It is a part of who we are, as in this field, is that we do that. And so we learn on our own, guys. That's a really big part of what we do. But with that said, it's a great thing if you decide to, pursue the degree, but don't just pursue the degree because you are brand new, you have no idea what you're doing, and you want to make the most money. Guys, you don't even know if you're going to like medical coding yet, right? And then you want to do something like that, it just doesn't make sense. Don't get yourself into debt because you think that that's the best way to go. And there's people out there that are actually getting even their medical coding certifications for the same amount as you would spend to get a degree. So again, it's just, you have to shop around and you have to be smart. The average amount that you'll pay for a medical coding school, medical coding program, is $5,000. If you are paying more than that, it's just too much money, guys. Okay, it's just too much. $5,000 is the average. There was a lady on LinkedIn who was like, well, where do they charge that? Everywhere. That is the average when you look at all of the fees and all of the books and everything else, okay? Sometimes you may find a cheaper program, and you got to watch those cheaper programs because it depends on the quality of the books as well. With these cheaper programs, they use different low quality books. I will say that they use a lot of them use low quality books, and I know because I'll look at the at their website and I'm like, oh my gosh, that's the most horrible book to learn medical coding from. But I always say that if you're in one of these programs where you're not really learning and maybe the material is not as user friendly, look in the description box, guys. I list the 2 books that I recommend for learning medical billing and coding. At least to learn the basics of diagnosis coding, procedure coding, and modifiers and things like that. There's a call coming in on the phone, and I was distracted for a second there, guys. Sorry. But with that out of the way, you really have to look at your program, and you really have to see, what is it that they're offering, okay? And again, if you're spending more than $5,000 to learn medical billing and coding, you're spending too much money, okay? Now, there are some schools, and maybe it's like $7,000, okay? But don't be spending $12, $13, $14, $15, $20,000 just to get a medical coding certification, okay? That's just not right, and it's just too much money, okay? You want to make sure that you're spending your money wisely, because even though some people spend $20,000 to get a medical coding certification, a lot of them tell me, Blue, I have no idea what I'm doing. And you spent that much money, you could have got a degree for that, But having a degree is not something that's required in order to have a good and lucrative career for this field, okay? I'm just saying, that's something that you all got to know. Some people have spent their entire careers with just a medical coding certification, just one, and they do really well, because it is, again, based on knowledge. It's based on what you have learned and how you're able to pick up new material as it appears, because we have updates every single year when it comes to these codes, and when it comes to the rules and the guidelines. You have to be flexible enough that you're not saying, we always did it this way, or we always did it this way. We did this way at my old facility. No one cares about your old facility. They care about what's going on at their facility, all right? And so, again, you have to be flexible enough to work with the rules and work with the guidelines and things like that. So that's just what I'm going to say on that. But it is a great thing if you want to pursue a degree after a while, like I said. And if you want to do that because you want to be a good, strong leader for other people, you want to be a positive role model, you know what it's like to be a coder, so that you can take the things that you learned as a coder to that leadership position, so that you can be in a good position to help more people. That's a good thing, all right? But again, don't just pursue the degree program because you think it's going to make you more money. It won't, guys, because I've proven that as a credential holder, and I was able to make more than somebody who has a degree. Okay, so, it just really all depends on where you are and what you're doing. But if you want to just pursue medical coding, start with the certification first. At least spend 2 years with it. At least spend 2 years in the field, and then see about pursuing the degree, if that's what you want to do. Some people want to pursue the degree because they want to feel like they completely know every aspect, right? And if that's you, hey, all the more power to you. But again, it's not necessary if you just want to be a medical coder. All right. There's a lot of other things that you can do with not even pursuing a degree. You can pursue other things like CDI, or just other things that you can do, like education as well. You can be an educator without a degree. However, there's going to be a requirement of time in and experience and stuff like that. So again, it's wherever you guys want to go. But I will always encourage you guys to, if you want to start in medical coding, start with the certification first, the CCS, CCA, CCSP, or the CPC, and spend 2 years learning. Spend 2 years with one certification, and then if you still insist on wanting to go and get your degree, then see if your employer offers tuition reimbursement, and then pursue it that way. Be smart about your money. Be smart about how you're spending it as well, because it's real easy to start racking up, debt if you're not careful. And you guys work hard for this money. Being a medical coder, it is not a physical job, it's a mental job, right? And as you know, if you've been out of the field before, mental work is just as tiring as physical work. I know, because I've been on both sides of the spectrum. I've worked physically demanding jobs, and I've of course been a medical coder for 15 years. And I know, even for myself, there are times when I have worked really hard all day on these records, and I'll come home and I'll hit the bed because I am so tired. Now, I haven't been able to do that in quite a while, but it's just something that happens, and it does wear you out when you're looking at these records all day and you're reading, But again, it's not anything that I would ever change, because it's a good tired, right? It is a really good tired. But that's just me. But like I said, when you are out there, you'll learn in those first 2 years. But like I said, make it easy on yourself. And I know I keep repeating myself, but make it easy on yourself. And make sure that when you're going through these things, that when you hit a bump, like you get confused, something, you're not understanding something, try to find different ways of learning to help yourself. This is my advice anyway. So I'm gonna go ahead and wrap this one up. Thank you guys so much for joining me. If this video helped you, please like, subscribe, and share, and I will see y'all next time. Bye.